It's really interesting because we take a shower almost, I mean, every day or almost every other day, depending on how entrenched you are in COVID. But we take a shower regularly. The point is, why don't we do that for our mental health? Every system has a different culture. So every university has a different culture. So one of the things that was, I think, difficult about being online this first year was that I didn't have a good sense of the culture, because the culture doesn't become readily apparent through online interactions, especially if people have their videos off. But even if people did have their videos on, you don't get the dynamics that occur among students. You don't see all the nonverbal communications other than facial expression. And so that makes it sort of hard to assess, like, well, what is the culture of these students? So in that way, I think it was different. And then I think all of us kind of got used to the online system. And now I think that there's some feelings of like, well, what is it going to be like when we actually go back in person? Like, what parts of this are actually going to stay the same? I think everyone to some extent is interested in it, right? Like, it's this part about our lives that we never talk about. We don't really have access to accurate information. And the information that we do get is either strictly about safety, so like STI prevention or unintended pregnancy, and not at all about pleasure, and not at all about identity, right? And then the other part of that is that, most of our what we see in our lives, what we observe, can be sometimes positive, like we might see our parents kiss, for example, but oftentimes, what we're hearing about is like discrimination, and we're hearing about non-consent, and we're hearing about all sorts of things that are useful to hear about, but also we don't have the positive aspect of that we get to know. And so to me, it's like, well, how does anybody ever find sexually satisfying lives? Like, given that we have no information about it. So that was like immediately intriguing. And I really wanted to study that and investigate sexuality from that lens. And I remember sitting in my human sexuality class and just like falling completely in love and just being like, oh my God, this is exactly what I want to do. There's like so many ways that we could change the world just by talking about sexuality. In fact, all we have to do is like start having the conversation, and we make change. And then I had two other loves: the brain, and I also loved the idea of clinical psychology, because I really wanted to help people, and I really wanted to basically tell people that what they were struggling with was okay. And so from there, the clinical psychology path is a challenging one. There's actually a lot of things that you can do if you're sort of know that what you want to do is be a therapist. So there's a lot of master's programs, and you can tailor your experience to the specific clientele that you would want to work with. But for me, I kind of didn't really know exactly what I wanted to do, and I also had this like love of research, and I also had this like very clear, I want to study sexuality. And so to put those two things together was really challenging. And I looked at all the programs all over the country, and very few places would allow you to study both sexuality and clinical psychology. But I found like three people where that was the case. And I applied to those three people, and luckily I got in, and I studied with Lisa Diamond, who's at the University of Utah. But that was interesting too, because I was like, well, okay, going to Utah, I was a little scared, right? I was like, am I going to get beat up? Like, is the nature of me even going to Utah like a real possibility? Like, are there any queer people in Utah? And B, am I going to, get bullied? And so, and luckily my advisor at the time was like, no, this is like the hub, of LGBTQ folks in all the Rocky Mountain area. And I went to Utah, and I fell in love with it. We don't talk about sex in our culture, and we don't have a lot of access to really great information. However, people have actually, because it's of interest to folks, people have been studying sexuality for a while, for a long time. In psychology, that's less so the case, and particularly within clinical psychology, that's less so the case. The idea of even being able to get an educational experience in sexuality is relatively new within psychology. So all of my mentors are basically self-learners. And it's like I'm of the first generation that's really getting clear education based on sexual information, right? Like that I actually took classes about sexuality. So that's kind of like a big deal. Well, I would say that because we get so much misinformation about it, like the best way is to get some accurate information. So I'm on a mission. That's my mission is to increase people's sexual literacy, right? That we have information, we can access it. I really want to see a world in which people can easily get good information about sexual health and sexuality and sexual identity. So the first thing I would suggest is like, if you can, taking a class about it. I was just reviewing some of the feedback that I got from students at the end of the quarter when some of the things that they said was like, this needs to be required class. And I kind of do think that it does, right? Like we kind of need a situation where people are actually accessing good information. Because here's what we know about sex ed in high school and middle school. There's a lot of topics that don't get discussed. The topics that do just get discussed are often they just scratch the surface and they're often fear-based, right? So like, here's your vulva with genital warts. And you see a picture of a vulva with genital warts, and that's the information that you get. Not very like informative, right? And so people don't really know what to do with it. And so they're just sort of scared. And there's a lot of things that go into, let's say, for example, somebody using a condom in one particular sexual activity. It's multifaceted. And so having people to understand what that process is and busting some myths about condom use, for example, is really, really important. But the other thing I think is like just to start having the conversation, right? Like you might ask your friend, have you ever talked about sex? Like, what was the most satisfying sexual experience you've had? That might get, really intense, right? So it's scary to ask about, but we should start to ask, and we need to start talking about sexuality in a way that's not pejorative, right? So a lot of times what we do is because we feel uncomfortable, we often, make jokes about it, or we tend to, like skirt the issue somehow, or we use language that doesn't actually describe the sexual components, right? So we have all sorts of terms for our genitals that don't actually refer to the names of our genitals, right? And so just being able to say the word penis, for example, like that could be really powerful, right? And so instead of saying like, hey, what's your, I don't know, whatever you call it these days, you can ask your friends like, hey, like, do you experience this? Or this is what I'm experiencing. Have you ever experienced that? Because a lot of times people go in with like some information like, or some myths like, oh, like men are always supposed to be up and ready to go for sexual activity. It's total myth. Like you're human. You're not supposed to be up and ready to go for anything, right? Like, things change and there's waves, right? And the same thing is true for women and non-binary folks and trans folks. And the LGBT community. And we just need to be able to begin having those conversations. I definitely see that there's sort of two components, and I think they are related to one another. One is being sort of so outcome focused on the grade that they get. And it's for a good reason. Like I understand the stress that's associated with it. But part of the problem when you're so outcome focused is you actually miss the learning that happens, that like a grade is supposed to assess learning. And that's the ideal world, right? And so the more learning you do, theoretically, the higher your grade should be. Yeah, what happens when you get so outcome focused? And this is, I think it's relevant to clinical psychology, because let's imagine you're a patient and you're working with a clinician, and that clinician is super outcome focused and is obsessed about you getting better. What's going to happen? You're just going to miss the entire point, right? Like you have a clinician that's super outcome focused. They say, are you going to get better? Are you going to get better? Are you going to get better? Well, there's another thing that might happen. A, you might just say like, I'm going to get better. I am better, when you don't really actually mean it. But B, you won't actually learn the skills to deal with all of the various life stress that exists, right? Because it's not about getting better. Life is not about getting better. Life is about dealing with things as they come. And the same is true for learning, right? Like learning is a process. It's a shift in knowledge over time. And I think students often forget that, or they don't, there's so much anxiety about the outcome that they miss the gems that are in the process. So I really wish, I mean, I understand the stress, but I do wish that students could just learn for the sake of learning. There's so much information. You can Google anything. Google doesn't tell you how to think. Google doesn't tell you what information is valid, what information you need to think critically about, and what information you can actually just accept. That's the process that you are learning in college throughout all of your classes. And you get to learn from all of these different disciplines. And all of these different disciplines embody a partial perspective, right? They say, okay, we're going to teach you how to think from this lens. I'm going to teach you how to think from the psychological perspective. You go to gender studies, they're going to teach you how to think from a different perspective. You go to history, they're going to think about a different perspective. You go to biology, they're going to teach you how to think from a different perspective. Your job then is to integrate all those perspectives, right? So that you can learn not what to think, but how to think. And so I think that critical thinking is a really important part, that when you're so focused on the outcome, critical thinking is really hard work and it takes some time to get there. And so when you're really focused on grades, you actually miss that. And that, I think, is the most crucial part of the college experience. I think that there's a lot of work that's being done now on how different identities experience a lot of barriers, not just in higher education, but in general in life. And I could answer this question by telling you the barriers that I experienced, but I want to instead tell you about what helped me get through those barriers. So I had professors that I connected with and believed in me when I couldn't believe in myself. And that was really powerful. And those having mentorship is really critical. And you can find mentorship. Mentorship doesn't have to be this like one single person that you get to know. Perhaps it's a professor in a class, and you just really liked the material that was presented, and you really liked the way their style was. Perhaps it's a moment, an interaction that you have with somebody at the student union getting food, and it's just an more advanced student who's just making casual conversation with you, who drops a gem inside of you, right? Like those are these little moments, these interpersonal interactions that we have, which is what we missed during COVID, are the moments that can really help or hinder your experience. And so the more that you can engage in community, and the more, and there's a whole host of research that suggests that social support by far is one of the best predictors of buffering stress that's associated with identity and discrimination. So I think that that's really important. And I think the other thing is finding something that you do that feeds who you are as an individual, right? So we're doing all this learning, we do all this STEM learning, we all, we're focused on biology, we're focused on the scientific method. And that's wonderful. I think the scientific method is a beautiful way to think. We also are just human beings. And so some of us love art, and some of us love, hiking, and some of us love whatever it is. And so to find that thing that you are really, that makes you feel whole is really important as well. In the context of the reason why I think therapy, one of the reasons that we know that therapy works is actually nothing to do with the therapy or the therapy itself or the therapist, but actually this dedicated time of 1 hour a week for you. So whether that be therapy or whether that be something else, like it's just nice to carve out, to schedule time in, right? To sort of say, okay, this is the hour a week that I get to do whatever it is that I want to do. Maybe it's exploring interests. Maybe it's trying something new, but it could be anything. So I think dedicated time, especially for people who are so focused on that resume, you only do the things that are on your schedule, right? I think just find time to be. Being is different than doing. I think that we live in a society where we're all expected to be really productive. And that's great for the society, right? But we're still individuals. And individuals need to just be sometimes because the actual joys of life actually happen in the moment. They happen right now. They don't happen yesterday. They don't happen tomorrow. They happen here in this moment. So, as much as you possibly can to be able to cultivate a present moment awareness, the first step of that is just to allow yourself to be. Though I guess there's one quote that's coming to my mind, which is stop shooting on yourself. It's one of my favorite clinical psychology quotes. And the whole point of that is like we make all these judgments, right? Like I should do this, I should do that, I should be this way, I should. Same component, okay, same idea, right? As the like just be like, no, we can stop shitting on ourselves.
Thanks for watching. Hit the like button and comment with your own thoughts and experiences. If you'd like to see more content like this, please subscribe to our channel at ReLyfe Videos. Let's rehumanize.